part of the research that was conducted. The patient case report. Mr. X. He was presented to the emergency room for a sudden onset of spontaneous ecchymosis and muscular hematomas. He denied any recent activity of risky behaviors. For 3 days, presentation that he has been following are anti-inflammatory drugs, renal colic, and physical examination marked. Then what happened is that signs and common symptoms, Mr. X did deny because he did not show anything that was present. Poor appetite, bloating, abdominal pain, diarrhea, those are the symptoms. One thing you should actually note is that most adults have symptoms that are unrelated to digestive system problems, such as anemia, osteoporosis, osteomyelitic, and blisters on the skin, rashes, itchiness, damage to dental enamel, ulcers in the mouth, fatigue, damage to the nervous system, aches in joints, and also head and acid reflux, as well as heartburn, which are some of the symptoms that are unrelated to the digestive system because they become very common. You can have joint problem and have nothing with the digestive system. You have arthritis. So this is why it was a bit difficult for Mr. X to actually notice that he's very, very sick. When Mr. X came to the hospital after those 3 days where there was very concisive, critical measures that were done to actually note what is happening with him, he was admitted to ICU, where extensive hematomas and drops in hemoglobin levels were actually first noted, followed by few favorable recovery after 72 hours of blood transfusion and nutrient support. That's where he started actually picking up. So upon history taking for Mr. X, he could recall some stools and few years past that other evidence of malabsorption were present. Testing for CD antibodies which were positive. His triglycerides were actually abnormal, and then Down syndrome and Addison from the family member that Mr. X has. So these are things that could have contributed to Mr. X having CD. This is within the 10-day after admission. What happened to Mr. X is that he was discharged, and then he started a gluten-free diet for 3 months with a follow-up, and a patient had to complete a normal blood count and an IRN with triglycerides seroconversions. Later on, 2 years follow-up with no recurrent hemorrhagic events were registered. This is what happened to Mr. X. These are the pictures when this is the first picture when Mr. X was actually admitted at hospital. He had multiple cutaneous ecchymosis on his right hand. So his right hand had a bit of those bruises that look purplish. And then this is the laboratory work. This is the results. This comes from the x-ray that was conducted. And then this is when the endoscope was actually put inside him to actually check what's actually the problem. Investigation. When doing an investigation, we had 46 participants after Mr. X that were actually interviewed and were identified. So 44 articles were identified, which 2 presented in 1 or more cases, not only the celiac disease. And then the age range was from 19 years to 74 years. Basically what happened is the test was for a hemorrhagic events, and then 90% of the patients 90% of the patients' symptoms were actually unrelated. Some had other different types, and we also had to consider male and female, ethnic groups, and different other things when we had to do this investigation. this is the result interpreted. We have the hemorrhage where we have 390 patients. Hematoma, we have 32. Hemorrhagia, we have 15. Hemoptymosis, we have 23. Epistalis, we have 5. Hemorrhoids, we have 48. So this is what we need to know with the blood conjugulant diseases. Gluten diseases before test. These are the diagnoses that you need to consider. Can I put a pause? A continuation. I had to drink water. My throat was getting a bit dry. That's why I had to pause. When we come to the diagnosis, we need a gluten product, gluten sample. We need blood and genetic tests, whereby the blood test we will check for antibodies within your body, and the genetic test what we're checking for is the HLA, DC, DQ2 and the DQ8. These are the genes that are actually found when a person has the celiac disease. If you don't have them, it's highly unlikely that you have celiac disease. But the last thing that will prove that you do not have it will be an endoscope. Treatment. Gluten-free diet is the very best treatment.